Uganda is actually said to be nearing uncontrollable number of transmissions. Health authorities in the country say the fight against the disease has somehow been lost. Uganda Broadcasting Corporation correspondent Sahara Abigawa reports.
At the time President Yoweri Museveni announced a total lockdown of the country, all appear to be managed well with few cases, most of whom recovered, and the country began to open up. The fear of contracting the disease stood between 70 and 80% between March and May. However, with non-compliance with the set standard operating procedures, especially washing of hands and social distancing failing among many communities, hell broke loose and the infection rate shot high. The standard operating procedures have generally been dropped, and one only has to venture into downtown Kampala's Kikubo Lane and Womo Street to understand why Kampala Metropolitan is long-standing the hotspot for coronavirus. We asked the presidential advisor on the pandemics, Dr. Monica, on what went wrong on the management of COVID-19 in the country.
And of course, at that time, we were busy reading and finding out what is it that we can do. But in that time, we were not communicating to the public what is happening. And so other things came and took advantage. And one of the things that took advantage is politics.
As the country experienced a near COVID-19 spike, the ministry is first with upholding an image of excellence it boasted of earlier.
The population gave up observing SOPs. Then Kampala became overwhelmed.
The senior presidential advisor on epidemics, Dr. Monica Monsenero, says that Uganda is fast moving to the stage of uncontrolled transmission, especially in Kampala.
And we really can take back our lives from COVID. But this time the roles are flipped. Because at this stage, if you expect police to chase down everybody, it won't work.
Going by the recent COVID-19 curve, Uganda is headed for difficult times. Hospital beds are filling up very fast.
For my over 10 years as a pulmonologist, I've never had such a large number of people who need oxygen. I have run a pulmonary ward for all these years, would have like 3-4 patients. But right now, you find you have a ward of 200 patients, and almost 90% of them are on oxygen.
Lung Institute Dr. Bruce Kilenga says the health frontline workers are overwhelmed by the numbers of patients coming in for treatment, and also because of working for long hours.
So if you are going to be in this PPE from 9 to 4 p.m., it's really a lot on us. You really become dehydrated. You sweat from head to toe several times.
This is the general public managing COVID-19 at home to adhere to the standard operating procedures.
So if you intensify measures, washing hands, but most important, putting on a mask and staying away from each other. That's what people should do when they have someone who has COVID in the home.
Uganda has registered over 28,000 COVID-19 cases and over 250 deaths. The Ministry of Health now wants Ugandans to act responsibly to survive the pandemic. Zahara Abigawa, Kampala.